Welcome YouTube. So today we'll answer your questions on the USC, United States Clinical Experience, something which is one of the most important parts of your ERAS application and residency interviews. So we'll answer questions like if you're getting an elective opportunity, but it is an observership at a university hospital, should you take it? Versus you're getting an elective hands-on opportunity at a affiliated clinic. How do you compare these two? Then terms like sub-internships, terms like externship, even that has a lot of students in confusion. So we'll talk about all these terms related to US clinical experience. We'll give you a hierarchy of these USCE so that you can make some informed decision as you evaluate the USCE. Welcome to our channel where we discuss all updates regarding the USMLE and give you step-by-step tips and guidance on all aspects of your journey. So if you're new here, consider subscribing to our YouTube channel and also follow us on Instagram. So today we are going to talk about United States clinical experience and USCE as it's called and answer some of the most common questions that we get. We'll also tell you which USC is more important, what exactly do these terms mean, and then give you a hierarchy so that you can understand where exactly each one of them fit. So let's start with some basic stuff. What is USC? As you may have heard, US clinical experience, you will hear these 3 or 4 terms. You will hear electives, you will hear externships, you will hear observerships, sub-internship, and clerkship. So we are going to go step by step into each one of these terms. But before we do that, let's understand the importance of the US clinical experience and why the programs value it so much. Now, US clinical experience has become a cornerstone or some very important aspect of your application, and programs value it quite a bit. So, at least 3 months of USCE. And the reason is number one, it helps them gauge your understanding of the US healthcare system. Second, it earns you those very, very valuable letters of recommendations that programs really think is very critical. And this is where the home country LORs lose value as opposed to the US LOR. So this is the second important part you want to think about as you think about the USCE. The third important reason for USCE is just pure networking. It can open doors for you for research, for further USCE, and just networking with possibly the attendings, the chief residents, and other important stakeholders at the various residency programs, which can then eventually lead to some more interviews for you. Okay, so now let's clarify some of the most common terms, starting with electives. Now, as you look at this graphic that I have, you will see that electives are at the top of the USCE pyramid. And why is that? So first, what are electives? Electives are, as the name suggests, these are the elective courses that you take while still in the medical school. They should not be confused with the core rotations that you have to do anyway, medicine, OBGYN, pediatrics, and so on. So those are the core rotations. Electives are things like courses like the GI, the HEMONC, cardiology. These are the elective courses that you take. And if you can do them in the US, you really, really have a very good chance to improve your profile because of this USC. So that is elective. And then you will hear the term clerkships. Now, clerkships are the core rotations. Typically, IMGs will not do these core rotations, like I mentioned, the pediatrics, internal medicine, OBGYN, surgery. They will not do it in the US. They will probably do it in their home country. But these are also called clerkships. However, there are times that you may get an opportunity to do clerkships here. So, obviously, equally valuable. So, the important thing to note here is both electives and clerkships can only be done when you are a student, when you're still a student, and obviously for places, for countries where internship is included as part of your medical school curriculum, many of the students will do it as part of their internship. So they will do electives while in the internship year. And that leads us to the other term, which is called sub-internship. So not to be confused, sub-internship also means, in the internship year, you are here in the US doing the USC, pretty much the same impact as electives or clerkship. So electives, clerkships, sub-internships, what you do as a medical student, all have very high value here. So, what do you actually do in an elective? As a visiting student, you will have an opportunity to interact with the patients. You will have an opportunity to present the patient, discuss with the attending, discuss the plan. You will be working with the team of attendings, other medical students, and even residents. So, this is an excellent opportunity for you to get exposure to the US healthcare system. So, in terms of learnings coming out of the electives, you will learn the use of technology tools like EMR. You will learn about the evidence-based medicine and the patient-centric approach. So three main things which are very critical as you do your application and the interview. So these are the things where there will be a lot of discussion. More importantly, you'll be part of the team here, and the programs have absolutely no issues in terms of your malpractice insurance because you're still a student. So a golden opportunity if you get the electives, clerkships, sub internship while you're still a student. You should definitely strongly consider it. Now, what are the requirements for getting into these electives? Different universities and hospitals have their own requirements. Typically, it could be step one, it could be TOEFL, and there is a separate video that we have done on step by step how you look for electives. So I'll have the link in the description below so that you can see what are the typical requirements as you consider these electives. Now let's move on to the second term, externships. What are externships? Now, externships are also experiences, clinical experiences. They are hands-on experiences, but you get these typically after you graduate. Now, hands-on experience, if you can get an elective, that is golden. In electives, you can also get observerships where you are just observing, and I'll come to that. But typically, the term externship applies if you have already graduated. That's what externship means. Now, getting inpatient experience as an extern can be very challenging because of the various regulations, malpractice insurance, and so on. So, most externships that you will see are at outpatient clinics where the attending may give you more flexibility and then take you to rounding in an inpatient environment. Most of the times, these externships can be slightly cheaper than the electives, and definitely, if you do not have electives, you should strongly consider these externship opportunities. Of course, our team helps you with both electives and externship opportunities. So, if you're looking for some of those, take a look at our website, and I'll have the link in the description below. The third is observership. Now, as an observer, the name signifies you are shadowing a physician without much of a hands-on activity. You probably may not be able to interact with the patients. There are some limitations in the observership, but many students who cannot get electives may not have been able to get externships. Will have to go as an observer. So this is the third category. However, don't think that all observerships are a waste. If you are getting an observership at a top university program, obviously that will add a lot to your CV. And the second is it helps you fill the gaps in your CV. It helps you prepare for possibly more externship opportunities because something is still better than doing nothing. And finally, there is obviously always that networking opportunity. It may open door for research opportunities. So if you're not getting externship, you're only getting observership, even that can help build your CV. So before we move into the hierarchy of these USCE, just to summarize, there are four things that you should always remember. The USCE is very important, and try to have minimum 3 months of USCE before you are ready to apply for the residency applications. That's one. Second, whether you do electives, externship, or observership, try to be involved, do presentations, network with the team. That will really, really help you. And as you network with the team, you should also try to do some case reports or something in research, which can always boost your CV. Basically, the intent here is of these USC, etc., not to have gaps in the CV also, especially if you are a graduate. And finally, the fourth thing is because of the pandemic and the issues with travel, you will find that tele opportunities are coming up, the tele rotations. Now, If you cannot do on-site rotations, many university programs and affiliated clinics have come up with strong tele-rotations. We have a separate video on tele-rotations, but don't think that they are a waste. They are also becoming very legitimate forms of USE. So you should consider that, especially if you cannot travel because of all these issues. Now let's talk about the hierarchy of these experiences, as I was mentioning earlier. So if you look at this graphic, at the top is the university program. So university program rotations, electives, etc., are highly valuable. After the university programs are the residency programs. They may be community programs, but residency programs, they come next. They are community programs, so they are number two. And the third is the affiliated clinics. So these clinics may be affiliated with residency program, whether a university program or a community program. So they are number three. And then, of course, are all other clinics which may not be affiliated with any residency program. Now, as I mentioned, university programs come at the top. So in a university programs, many of you may also get research electives. If you are getting research electives, consider it very, very strongly. They are also very valuable. And within the university program, like I said, if you're getting hands-on electives, great, but even observerships, now you may have graduated. So even observership in university programs are highly rated. So why are these university programs so highly rated? It is the intellectual rigor they provide, it is the resources that they have, and it is just the brand name that they tend to provide, which makes your profile well rounded, that these are something that most students would want to go to. Then after the university programs come the community hospitals. So these are the hospitals which have residency programs. Now their research may not be as strong as a university program, but their clinical skills, the skills that they offer, are very strong. So uh, consider these programs also if you have the opportunity. These are the programs, the hospitals where more and more IMGs go for their residency. So it actually provides you a foot in the door for that residency position that you may be looking for. So after the university, it is these community hospitals with residency that come next. So then comes one of the most common forms of the US clinical experience, which is at the affiliated clinics. So these clinics are run by attendings and they have dual appointments. So they have their own clinics and then they have privileges at the hospital. So in the clinic setting, you may have full hands-on externships, and they take you then weekly or more than once a week to the hospital or the program where they are affiliated for rounding, and there you are an observer. Now, the advantage of many of these affiliated clinics is they use the same EMR as the main hospital or the program, so you can actually get exposure to the EMR system. The LOR can tend to be more personalized. You will get more responsibilities. I mean, our students end up seeing 10 to 15 patients a day. So, more responsibility, more learning, customized LORs are some of the reasons why many students then pick the affiliated clinic model if they cannot get the university or direct in hospital inpatient experience. And then finally, of course, you will see rotations in clinics which are not affiliated with any program. So if you have no other opportunity and you're getting it in a clinic, it is okay to do a couple of rotations in these clinics, but remember that their LOR will not be as valuable as some of the other things that we have discussed. So the university program, the hospitals, the residency hospitals, community hospitals, and the affiliated clinics. So think of these independent clinics as stepping stones where you will possibly learn a lot, and then you can use these learnings to get other kind of USCE to help you further. Finally, you will see rotations where you are rotating with either a nurse practitioner or a physician assistant. Again, it's down in the hierarchy. So you have to remember that something is definitely better than not doing anything. It's just important to know the hierarchy. Now, you may ask, what about telerotations? Like I mentioned, telerotations have come up very strongly because of the pandemic of the past year or so. So, if you're not able to travel, if you have other constraints, then you can consider telerotations. Also, there are various types of telerotations: patient focused, where you actually interact with the patient, present cases, and so on, or didactics focused telerotations. And we have a complete video on telerotation, so I'll direct you to that in case you need more information. So that was all that we had. Hopefully now this gives you a clearer picture on the type of the US clinical experiences and a hierarchy to understand the importance of various clinical experiences. So let us know if you have other questions, if we missed anything, and share with this video with others who may benefit from more information on USC. Good luck for the upcoming match.